Hello everyone, I am Makoto Nishimura, attending physician at Memorial Sloan Kettering Cancer Center, New York.
And I am Mako Koseki, a visiting researcher working with my esteemed mentor, Dr. Nishimura. On behalf of the co-authors, we express our gratitude to GIE for allowing us to share our research in this issue of journal titled Feasibility of Esophageal Endoscopic Submucosal Dissection After Radiofrequency Ablation Treatment in Patients with Barrett's Esophagus. We also appreciate the opportunity to present our article in this interview and are eager to share our findings with you.
Okay, Dr. Koseki, so could you tell me why did you conduct this study?
Yes. In the US, RFA is a well-established treatment for dysplasia caused by Barrett's esophagus. Similarly, ESD has been widely performed for nodular mucosal dysplasia and early carcinomas. While previous data suggests the feasibility of ESD post-chemoradiation therapy, there is a lack of report regarding ESD conducted after RFA. Therefore, this study aimed to assess the feasibility and safety of ESD in patients with a prior RFA treatment.
Okay, so could you explain about patient characteristics of this study?
Yes. Over the course of 4 years, a total of 7 cases underwent ESD after prior RFA treatment at our same lesion at our facility. Of the 7 cases, 6 cases had a history of multiple RFAs, and 1 had undergone RFA once. 3 were located in mid-thoracic, 2 in lower thoracic, and 2 in GE junction.
So could you summarize the results?
Yes. As for the results, all cases achieved en bloc resection, with 6 of 7 cases achieving R0 resection. Among these, 5 cases were classified as PT1A, 2 as PT1B. No complications such as pneumonia, perforation, or delayed bleeding were observed post-ESD. Furthermore, none of the patients experienced recurrences at the 1-year follow-up. The 1 case that did not achieve R0 resection underwent brachytherapy after ESD with no subsequent recurrences.
Okay, so let us share the video.
This video is ESD of case 2 in our article. 82-year-old male with a history of Barrett's esophagus, high-grade dysplasia, and PT1A carcinoma status post-RFA twice, who was diagnosed with recurrent adenocarcinoma at the same lesion. Here, we can see the targeted lesion on the right side. Using the NBI, we put markings with enough safety margins. Even with a lot of scar tissue from RFA, using an injectable needle, 1.5 mm pro knife, we could successfully inject to raise the mucosa and go underneath the submucosal layer with successful removal at the end.
Okay, so what is so unique about this study?
Yes. In the US, it is estimated that approximately 5.6% of the population has Barrett's esophagus. Many patients undergo RFA and cryotherapy for dysplasia treatment. However, there are limited previous reports for performing ESD cases with prior treatment. Consequently, reports on ESD post-RFA and esophageal lesions are scarce, likely due to the higher frequency of RFA use in Western countries compared to East Asia, where ESD is more prevalent. As a facility that conducts numerous cases of both RFAs and ESDs, we were motivated to undertake this study.
Okay, so why ESD is more beneficial for the lesions which underwent RFA?
Yes. In this study, some cases were refractory to multiple RFA therapies, prompting consideration of alternative interventions. In our ESD cases, 6 out of 7 achieved curative resections, thereby enabling patients to avoid esophagectomy. Even in the case where curative resection was not achieved with ESD, the patient opted against surgery, but carcinoma was successfully treated with endoscopic procedures alone.
Okay, so what is the strength of ESD compared to repeating RFA or cryotherapy?
Yes, the strength of ESD lies in its ability to provide a complete pathological assessment of the lesion by dissecting the entire area. While RFA and cryotherapy are effective techniques for treating early lesions, the certainty of achieving curative resection with these methods is unclear. Therefore, ESD proves to be particularly valuable in such cases.
So please conclude this study.
Yes. In conclusion, our article demonstrates that ESD could be a feasible and safe option for patients with a history of RFA in patients with Barrett's esophagus. While there are numerous options for refractory and recurrent lesions following RFA, guidelines do not specifically address the disparity of one treatment over another. Our aim is to break the negative cycle of dysplasia. Our next step is comparing the long-term outcomes of patients who underwent ESD versus who underwent other non-dissection treatments.
Thank you so much, GI, for this opportunity. We would like to proceed this study furthermore and develop ESD skills to overcome difficult lesions. Thank you.